Sarah Blower. I'm the lead research fellow for the Best Start work stream of the early life and prevention theme of the Yorkshire Humber Arc. I'm an applied researcher with a background in psychology. I've been active in research for around 16 years now. 10 of those I was working in an independent charity that was providing a kind of interface between high quality research, evidence, policy and practice. And then latterly, for around 6 or 7 years, I've been at the University of York in the Department of Health Sciences. My work has been largely around the design, adaptation, and evaluation of interventions and services for children and families, and a lot in collaboration, close collaboration with health providers, local authorities, charities, working closely with them to identify programs that might fit in the services and infrastructures that they work in. So we've been working very closely with health visitors, psychologists, families in Bradford and in Doncaster and North Lincolnshire to develop a questionnaire or a tool that can be used to assess maternal infant bonding. So mothers' emotional connections and feelings towards their babies. And we've been developing that tool largely for health visitors so that they have something to structure their conversations around bonding and attachment in their routine visits. And it's now being piloted in Doncaster and North Lincolnshire in routine health visitor appointments. And also it's being used in one of the Born in Bradford cohort studies. And then we're going to gather that data up together and collate it and explore whether that tool, which we call the Me and My Baby tool, it's the MAM-B, and we're going to explore whether that's valid and reliable. Is it measuring what we hope that it will measure, and is it useful? And then subject to any further edits, that tool will then be freely available for practitioners and researchers across the region or anywhere in the world to use. And then another one is a collaboration with the minority ethnic health and inequalities work streams. So that is exploring inequalities in the identification, referral, management and treatment of perinatal mental health difficulties in mums and also in dads. We're trying to understand what inequalities exist and examples of best and challenge practice, really, to try and reduce those inequalities in the systems in that area. And we hope that actually what we generate from that is a set of tools and methods that maybe could be used in other ARC regions to explore similar issues. I think one of the major highlights for me was representing the YHARC at a cross-ARC child health networking day in London that was hosted by Penn ARC. And it was just a really fantastic day where we brainstormed ideas. It was really great to see all the really innovative stuff that's happening in the different ARCs across England, and just the potential for opportunities to collaborate with other regions and share learning and best practice. It was just a really fantastic day. What I'm looking forward to is the opportunity to work with and learn from the expertise that sits within the different areas of the Yorkshire Humber Art, the ability to kind of easily access health economics advice and just different skill sets and experiences, and being able to then use that in collaboration in work with practitioners and frontline service managers. I think it's the collaboration element and the infrastructure that the ARC provides for that I'm really looking forward to capitalising on. And I think as well, the emphasis on capacity building. So that's capacity building for researchers like us. You know, what skills can we improve to ensure, you know, the work that we're doing is really as effective as it could be, but also, you know, sharing knowledge and experience with practitioners and vice versa, to build their capacity around some of the skills that we traditionally provide around measuring outcomes, selecting measures, different types of evaluation design, you know, approaches to developing interventions and adapting them. I think that that's infrastructure that the art provides is really the key thing that I'm looking forward to. The thing that inspires me the most, that I absolutely love about my job, is when I have the opportunity to be in a room with a group of practitioners who are providing services every day to children and families, and we are there to work together to create something new or adapt something that's already been delivered. And it's that blend of the research evidence and the methods that we bring as academics, and the extensive practice wisdom and experience of people who every day support children and families. It's when those two things come together to create something that is just the most exciting thing, and the thing that I love so much about my job. You know, whether you're a practitioner or a researcher in this field, we are all working towards the same goal, and that is that we want to support and help children and families, you know, reach their potential and ensure that they have positive outcomes and a healthy, happy life. So that's what it's all about for me.